Thank you, everyone, for joining us for London Health Sciences Center's June 2026 Community Update Meeting. Before we begin, I'd like to deliver the land acknowledgement. So I'd like to begin by acknowledging that we are gathered here today on the traditional lands of the Anishinaabe, Haudenosaunee, Lenape, Ottawa neutral peoples. These lands are connected with the London Township and Sombra Treaties of 1796 and the Dish with One Spoon Covenant Wampum, which reminds us of our shared responsibility to care for the land, the resources, and one another in a spirit of respect, balance, and cooperation. In healthcare, across our organizations, we also acknowledge that reconciliation requires action. Indigenous communities continue to experience inequities in health outcomes, in access, and experiences of care, and meaningful progress depends on substantial and sustained partnership, sustained and substantial trust and leadership that's willing to challenge systems and barriers that persist. As we gather here today, may we honor the original caretakers of this land and commit ourselves as an inclusive leadership community to leading with compassion, courage, curiosity, and respect in service of healthier and more equitable communities for all. So again, welcome to the June 2026 Community Update Meeting. These meetings are an important opportunity to share what is happening across LHSC and to celebrate the work of our teams and the impact that they have on our patients, families, and communities. As always, these meetings are live streamed through YouTube and a recording is made available afterwards. Our meetings also replay on Rogers TV London. So today marks our final community update meeting before we pause for the summer break. Over the last 8 months, these meetings have been an important way for me and the members of the LHSC team to connect with you, share updates from across LHSC, and recognize the work that's happening throughout our organization. This month's going to look a little different, as I'll be leading today's meeting on my own with some very important updates about the future of LHSC. Since September of 2024, I have served as supervisor of London Health Sciences Centre. One of my responsibilities is to provide both an interim and a final report on the organization to the Ministry of Health and to the public. Today, the Ministry of Health published my supervisor's interim report, which summarizes the events that led to my appointment, the work we've been doing to improve, and our next steps. This report's difficult to read, but it is also necessary to read. It details significant governance failures, leadership instability, financial challenges, and breakdowns in oversight that developed over many years and ultimately resulted in provincial supervision. As supervisor, I believe it's important to acknowledge these realities openly and candidly. I know our patients, families, donors, partners, and community members heard about them over the past 2 years, and it's critical we rebuild community trust in LHSC. That can only be done through honesty, accountability, and meaningful action. Over the past 2 years, we've been transparent about these issues, the lessons learned, and the work we're doing to improve. While the report highlights challenges, it also talks about resilience, renewal, and recovery. The most important message I want you to hear today is this. The failures outlined in this report were not failures of frontline care. They were failures of governance, oversight, leadership, discipline, and organizational control that developed over many years. Throughout all of this, our nurses, physicians, dentists, midwives, allied health professionals, researchers, support staff, volunteers, and patient partners continue to deliver outstanding care and world-leading research. These people carried LHSC through an incredibly difficult period, and they deserve enormous credit. So what does the report actually show? You can find details in a letter to the community on our website and the full report, which is available on the Government of Ontario's website. It's a link in the community letter. However, I want to note that the issues at LHSC did not emerge suddenly, and they did not begin a couple of years ago. The report outlines, among other things, that over the last decade, LHSC cycled through 6 CEOs, 6 CFOs, and 41 executives. That level of instability has consequences. Administrative structures became layered and overly complex. Accountability became diffused. Decision-making became fragmented. The report also highlights a 2021 report that warned about deteriorating culture, broken relationships, low morale, financial pressures. Those warnings were not effectively addressed. And the report further outlines procurement irregularities, governance failures, inappropriate travel decisions, financial instability, broader oversight breakdowns that collectively eroded public confidence and ultimately required provincial intervention. The Government of Ontario acted decisively when these issues became apparent. However, I want to be clear that supervision was not implemented because patient care was compromised. As I mentioned, our team never wavered in delivery of great care. Supervision was implemented because, again, of underlying leadership, governance, operations, policies, controls, and financial processes that support the delivery of great care, but that delivery was not at risk. How we're rebuilding. As I mentioned, over the past 2 years, we've been transparent about what went wrong and what needs to change moving forward. Many of those improvements are already underway here at LHSC. We've made significant improvements to leadership and governance, strengthened oversight and accountability, and introduced stronger financial discipline. Over the past 2 years, LHSC has done the following and much more. It's redesigned its governance framework, including strengthening the board structures, enhanced director education, clearer accountability, and stronger committee oversight. We reduced and streamlined management structures, including a reduction of more than 50% in executive leadership positions and simplified reporting relationships. We ensured medical leadership was embedded in decision-making alongside and with the executive leadership team. We restored independent internal audit oversight and expanded whistleblower reporting mechanisms to strengthen accountability, transparency, and fraud prevention. We updated procurement, contracting, and conflict of interest processes to improve oversight and compliance. We introduced post-employment restrictions for designated leadership positions. We implemented stronger financial controls, including enhanced budget oversight, monthly financial review processes, and comprehensive cash flow management. We have advanced nearly 200 recommendations from independent organizational reviews and extensive feedback from staff, patients, families, and community members. We improved patient and family issue resolution through greater involvement of executive and clinical leadership. We renewed, strengthened, and modernized critical partnerships with St. Joseph's Healthcare London and Western universities to strengthen patient care, education, research, and regional planning. We've established new transparency initiatives, including these monthly public community update meetings and open media question and answer sessions. We've introduced a more disciplined, data-driven approach to workforce planning that aligns staffing and resources with our peers, patient needs, and service demands. So this report's interim. This work's not complete. But LHSC is fundamentally different than the organization I walked into. There's stronger oversight, clearer accountability, and there's more transparency. And with that is a renewed focus on discipline execution. So that brings me to today's second announcement. Today, we are officially beginning the board renewal process for LHSC. Supervision is never meant to be permanent. However, our work's not complete. But LHSC has made significant progress, and we've established the necessary foundations to begin a return to traditional governance. While more work remains, the path ahead is clear. In the near term, we will continue strengthening LHSC's financial position. The board of directors will be recruited and onboarded. We will complete the renewal initiatives identified through our organizational review and community engagement efforts. Following that, most likely near the end of 2026, early 2027, the board will recruit a permanent president and CEO, develop new strategic plan informed by our community, you, and advance critical infrastructure investments. Over the longer term, our goal is to strengthen LHSC's role as a leader in patient care, education, research, and innovation, deepen collaboration across the region, and continue building a culture of high performance that our teams and communities can be proud of. So what does board recruitment mean? We've done the work to improve, and now we're ready to implement the governance structure that's going to support our hospital for years. This is an important signal that LHSC is moving towards a stronger, more stable future with the right structures in place to support accountability, transparency, and good decision-making for years to come. One of the key findings of my interim report is that LHSC's governance structure lacked processes, policies, oversight, training, and role clarity necessary to support effective governance. There were also issues with approvals either not going to the board or going to the board without sharing the full understanding of their impacts. Over the past 2 years, we've worked to build systems that will support effective governance. We have redesigned governance structures, implemented best practice policies, strengthened accountability mechanisms, developed new corporate bylaws, a new board policy manual, simplified committee structures, and developed a comprehensive orientation and education program once we start to onboard board members. So the renewed board now contains the following committees: Finance and Audit, Quality and Safety, Governance and Nominating, Human Resources Research, Medical Advisory, Fiscal Advisory. Also, we are restoring key academic and system partnerships directly into the governance structure with ex officio participation and collaboration engagement with Western University, Schulich School of Medicine and Dentistry, St. Joseph's Healthcare London, the London Health Sciences Foundation, and Children's Health Foundation. We're also committed to ensuring ongoing transparency and public engagement, and that they remain central to governance moving forward. When board meetings are virtual, we will continue publicly live streaming them, and whenever operational when they're live for the in-person meetings, we'll continue to pursue live streaming where feasible. This is a key part of the work we've been doing for the past 2 years to improve. The board clearly is not delivering frontline care, but decisions made at that table shape how care is delivered across LHSC. Just as importantly, the board should reflect the communities we serve and help ensure our teams are supported in the work that they do every day. This is an opportunity for you and others in our community to step forward and help lead one of Canada's largest hospitals. So you might ask, why does all this matter? So this matters because of the role LHSC plays in the communities we serve and beyond. LHSC cares for some of the most complex patients in Ontario, and the research has impact far beyond the hospital walls. The decisions made at the board table influence quality of care, patient safety, and the future direction of the organization. A strong board matters because strong governance matters. It supports accountability, transparency, and the long-term success of LHSC. So to put things into context, LHSC is a very large and complex organization. It's actually one of the largest research-intensive acute care hospitals in all of Canada. It's a team of approximately 16,000 staff, physicians, dentists, midwives, research learners, and volunteers and patient partners, providing care for more than 1 million patients per year. We provide multiple levels of care, which means we provide care ranging from common treatments offered at family health clinics to highly specialized care typically only provided by a university-affiliated hospital. This includes the diagnosis and treatment of rare conditions, uncommon procedures, and experimental treatments. We are well known for this care and the innovations we offer our patients. We provide care to people from London and surrounding communities, but also the catchment area stretches far beyond that. We provide care to those across southwestern Ontario and as far north as Thunder Bay. Each year, LHSC is a dynamic learning environment for over 4,000 learners, from medical residents to clinical fellows to nursing students, research trainees, and students in other disciplines like business. The specialized care we provide is only made possible through our research mandate. At LHSC, we're deeply committed to research and innovation through the London Health Sciences Research Institute. That institute has more than 2,700 active clinical research studies and has more than $113 million in annual research funding. LHSCRI is driving discoveries that improve patient care. So when we talk about governance, we're talking about oversight of a very large organization with a very large impact. So you might ask, what's a board do? So the role of the board is governance and oversight. This includes setting the strategic direction for the organization, overseeing quality of care and patient safety, and ensuring strong financial stewardship. The board also plays a role in CEO oversight and accountability and in monitoring risk and overall performance. This is about leadership, asking the right questions, providing guidance, and ensuring the organization is on the right path. So who are we looking for? We're looking for community-minded leaders who want to make a meaningful contribution, people with experience in governance and or senior leadership, strong integrity and judgment, and a commitment to public service. We're also encouraging applications from leaders across the public and private sectors, not-for-profit sectors, academic, Indigenous, community sectors, people who can think strategically, people who communicate clearly, and bring different perspectives to thoughtful, constructive discussion. And importantly, we're encouraging applicants from a wide range of sectors, backgrounds. So I'll just go through some of them. We're looking for people with expertise or involvement, healthcare systems, clinical practice, public health, population health, equity, diversity, inclusion, accessibility, anti-racism, Indigenous health, reconciliation, partnerships, finance, audit, risk management, capital planning, investment, law, ethics, privacy, governance, research, innovation, labor relations, human resources, community development, health system transformation, artificial intelligence, digital transformation, IT, cybersecurity, large-scale capital involvement, infrastructure, people with backgrounds in government, public policy, stakeholder engagement. Also, we're looking for patients, families, caregivers, or community engagement individuals, and clearly individuals who have lived experience as a patient, family member, caregiver, or community advocate. It's going to be a board that reflects our community, and it's important that this happens, that the board that's selected reflects the communities we serve. We are intentionally building a board that includes a range of perspectives and lived experience. That includes welcoming applications from individuals from equity-denied communities. We know that these diverse perspectives lead to stronger decision-making and ultimately better outcomes and more inclusive care for the people we serve. Now, what do you need to know before you get involved? I want to be clear about what's involved. It's a significant volunteer leadership role. It's not paid. Board members can expect to commit between 10 to 20 hours a week. This includes meetings, preparation for the meetings, and engagement. And we're going to provide robust orientation and ongoing governance education. It is a huge commitment, but also one that many people find to be one of the most meaningful and impactful roles they take on. So at LHSC, great people lead great care. A seat at a board table is more than just a position. It's a voice, it's a responsibility, and a chance to shape care for generations of patients, staff, and communities for generations to come. The decisions made at the table have a real impact, and this is your opportunity to be part of that. This is your opportunity to make a meaningful contribution to help guide decisions that affect care, people, and the future of our community, to be part of shaping what comes next for LHSC, and to work alongside a group of people, I am telling you, are the most committed individuals I've come across in my history in healthcare. So if this is something that interests you or someone in your network, the process is pretty straightforward. You can visit our website to learn more about the role and the requirements and submit an application using our online form. We're asking for a cover letter along with a resume or CV. For those without access to the form, applications can also be emailed, sent by mail, or dropped off at the hospital. Applications are open now and are going to remain open until July 31st. All of the details are available on our website. So what's my message to you folks is, hey, if you're interested, consider applying. And it's just as important to share this opportunity with others that you think would make great board members. Often, the right people don't immediately see themselves in these roles, and unless someone gives them a little nudge and encourages them. So if someone comes to mind, give them that little nudge or encourage them and ask them, reach out to them and ask them to apply. So before I close, I want to thank our LHSC's Community Advisory Committee. They were a group of individuals that raised their hand when I was appointed, and they all individually shared their time, experiences, and perspectives to help ensure the needs and priorities of our community were not lost during the last 18 months of supervision. With the recruitment of the new board, CAC and myself were meeting next week for our last meeting, and we'll conclude our work. But I really want to thank them for making this happen. I also want to recognize and sincerely thank the many people who helped bring this recruitment campaign to life, including our staff, credentialed professional staff, researchers, learners, volunteers, patient partners, and patients. I'm going to show you a video, but before I show it to you, I want to give a big call out to our internal team. I am telling you, when you see the video and you're going to see parts of the campaign on social media and elsewhere, you're going to say, oh my God, why'd they spend all this money on that? We did it internally. This team here, the public relations and communications team here at LHSC, did a bang up job, in my opinion, along with the frontline staff, and I'll mention them in a bit. And here's one piece of it, a video you're going to see that's going to be featured for our board recruitment. So we'll play the video now.
This seat is about shaping care for thousands of families. This seat is about supporting your community. This seat is about stepping forward to make a difference. This seat matters.
So I think pretty impressive. That's why I had to preface it to say we did this internally, because again, I think it is definitely amazing quality. So I really want to thank again the PR and communications team here at LHSC for putting that together, and you'll see more of it. But also I want to thank, this is the group that makes this place tick. And there are just some of them on the video that immediately stepped forward to want to be part of this and knew how important this was. So I really want to thank people like Dr. Lim, Rachel, Hudson, Brooks, Elaine, Bill, Soshani, Heather, Chris, Allison, Dr. Lamb, Dr. Mansour, Jason, Andrew, Elf, Nevada, Carolina, Jillian, Tracy, Akul, Walter, Ardana, Lauren, Hilthreth, Joyce, Jordan, Dr. Appleton, Joan, Megan, Rachel, Mike, Denise, Mahegan. We are grateful for your involvement in that video and the campaign that the rest of the community is going to see, for the opportunity to connect with so many of you, and for you want to be so involved in this and know the importance of this. So thank you. So again, the work is about to begin, about building the right board for where LHSC is going. A strong, well-rounded board supports leadership, reinforces public confidence, and helps ensure we continue delivering high-quality care now and into the future. This is a community opportunity, an important moment for LHSC, an important moment for you and your colleagues. Please, if you're interested, apply. Thank you for everyone for tuning in today. Take care. Have a great rest of the summer.